Hi, everyone. I'm Callie49. My name is Kaveri Roy. I am an assistant professor of nursing at the School of Nursing at MGH Institute of Health Professions. I want to make very clear that I don't speak for the MGH Institute. This is data that I've collated myself from the experts. Thank you to everyone on Twitter that shares data, shares articles. It's really important. And I wanted to talk to all of you. There were a few requests about a presentation about the very basics of COVID, knowledge that I feel that's been overlooked. And I think that everybody has the right to knowledge, but I feel like we maybe have not been able to get this basic knowledge out to people. So hopefully you'll find that helpful, or a jumping point, or a starting off point. Again, all views are my own. This is free. I did not receive payment for any of this. Again, thank you for the data for those of you who have shared this on Twitter. If this helps at all, please share widely. I don't really care about credit or authorship. So I just want the correct information about COVID to get out there. And again, if any experts are watching this, please feel free to add in, or, I hope that you also put some other information out there as you've been doing. So thank you. So the way that I started talking to my students about this, I started in 2020. Actually, I was on a global trip with nursing students, with actually nurse practitioner students. I was in India when COVID started. I was in India for January of 2020, and it was on the news there every day, every day. And we were scared. We were worried that, we weren't going to be able to get back to the US, that we would be quarantined. And we were ready, to get temperature checks and all of that. And it was really interesting at the end of January, when I came back, or when we came back, there was nothing. It wasn't on the news, or very little on the news. And no one knew about it. There was nothing in the airports, nothing to screen us. And it was very different from when we were traveling through India, right? So this is a map. This is one of the more current maps of, how severe COVID is and where, right? And as you can see, the most of the severity, right? Most of the cases right now are in Europe, with the advent of BQ 1.1 and BQ 1. There's another variant, XBB, but that hasn't been as prevalent. We have been seeing BQ 1.1 here in the US, in New York and in California, which makes a lot of sense if you think about it, because those are two states that are really the gateway for people who are traveling to come in. So it makes a lot of sense. So I kind of give a global perspective. And one more thing is, we're not seeing all of the cases. So this map is likely inaccurate, because cases are not being reported in the same way as before. Here's more of a picture of the US. Well, it is the US, right? But again, this isn't really an accurate map. I mean, yes, we would expect states that have no COVID mandates to have higher incidences of COVID, right? But again, we aren't really collecting data on people being positive anymore. So this is, this is the best we have, or one of the best maps that we have, but it's not probably entirely accurate. I live in Boston. Wastewater has been a really good way of detecting COVID virus and other viruses, RSV, influenza, because, everybody has wastewater. The only issue is if places don't collect wastewater data. And we've seen a rise here in Boston. Probably BQ 1.1 is already here. So this is really the heart of the matter. This is what I started out teaching my nursing students, because I said, if you understand the pathophysiology of COVID, you can cut through all of that misinformation that comes about, right? And so here it is. This is the COVID virus, right here. And it's got these spike proteins. And what happens is, this is us. This is our cells, right? So this is, say someone sneezed, right? And we breathed it in. So this is our nose. And so we have ACE receptors in our ACE2 receptors in our nose, in our mouth. And so it comes in initially through the nose usually, and then it works its way down our throat, goes to the intestines, kidneys, and heart first. And that's because there's a large amount of ACE2 receptors there. So that's why we see the runny nose, right? The sore throats, the dry coughs, the diarrhea even. I think with BQ 1.1, diarrhea is really prevalent. And that's why we were seeing so many acute kidney failure cases in the beginning and myocarditis in the beginning, because that's where the viral binding takes place first, right? ACE2 also does something else really important. It increases a protein called bradykinin. And bradykinin does a bunch of things. Bradykinin causes pain. It increases capillary permeability. And what that means is your capillaries become leaky, right? So they become leaky, they let out fluid, they let out proteins, cells, etc. And the other big thing that it's part of is clotting. Okay, bradykinin helps with the clotting cascade. Okay, and as you know now, clotting is a huge problem with COVID, right? So what is essentially happening with this upregulation of ACE2, right? This ACE2, I'm sorry, with this upregulation of bradykinin, because ACE2 increases that, right? You get what's called a bradykinin storm. Okay, so there's increased permeability. And so we start to get edema or fluid, right? We get fluid in places, we get fluid in our lungs, right? So eventually, once COVID has worked its way past the nose, past the gut, past the kidneys and the heart, it will get to the lungs. The lungs have less ACE2 receptors, but they do have ACE2 receptors. And so once they get there, there's this fluid buildup in the lungs, but it's different. This fluid is very different because COVID causes the lungs to produce this gel-like substance called hyaluronic acid. It's a hydrogel, and so it's very thick and very sticky. And so the problem is when you try to intubate somebody with this thick, sticky mucus, it's not fluid, it's mucus almost, it's a sticky kind of fluid in their lungs, it's really hard to ventilate them. And so that's why there were such high rates of mortality with vented patients, because this gel was preventing adequate ventilation. The other thing it does, bradykinin breaks down the blood-brain barrier. So you not only see inflammation throughout the body, you see it in the brain too, right? And so what I want people to take away from this is systemic inflammation. There is nowhere that this virus is not going to go. And with inflammation, clotting is actually a part of the inflammatory process. And so what you see is this huge, massive systemic inflammation, right, with severe COVID, and clots everywhere. And COVID, the virus doesn't just leave when you start to feel better. You are still undergoing, your body's still undergoing the inflammatory process. And so that's why you see somebody who has an MI or a heart attack. Myocardial infarction is a heart attack. Someone who has a heart attack months out, or someone who has a stroke months out, or develops brain fog or dementia. This is not just something that is cured right away. It has chronic effects. This is our treatment protocol. I just put this here just so that my students could see. We've actually come a long way. When I first started teaching this, I had a University of Washington COVID protocol, which, if you look at that, if you Google that and you look at that, we've come such a long way. And you'll see here, there's ivermectin, but it's not ivermectin for COVID. Ivermectin is actually used for parasitic infections. So no ivermectin for COVID, okay? And frankly, yes, we have vaccinations, but as far as treatments after COVID, we're still doing remdesivir, right? Or drugs in the family of remdesivir, antivirals, right? We're still giving steroid. Those are still our treatments. So our treatments haven't varied that much. We now have Paxlovid. And I think there was a recent article that was on Twitter that Paxlovid, it reduces transmission, and severity, but I'm not 100% sure about that. So I will have to look that up, and I will get back to you on that. So remember that I was talking about the hydrogel, right, that develops in the lungs. So this is the gucky fluid that's in that happens when COVID gets to the respiratory system. And this is called a whiteout. And this is one of the worst case scenarios with people with severe respiratory illness, right? Because if you have all of this fluid and mucus in your lungs, right, you can't move air. And if you're not moving air, you can't perfuse the blood. You can't get oxygen into your blood to go and, perfuse the other organs in your body, like your heart, like your brain, the vital organs. So this is what caused many of our deaths, right? This whiteout. So now we get to complications. So again, COVID is an inflammatory disease, right? It's a virus that gets in through our airway. It's airborne. It is not droplet. It is airborne. Please get that clear. I'm not sure why that took so long to get out there, but it is an airborne virus, and it then binds and affects most of the organs in our body. And these complications come from our response, our body's response to the disease, right? Here, it can cause vasculitis. So it travels through our blood vessel and it injures our blood vessels. And our kidneys have very tiny blood vessels, right? So it inflames and causes clotting, which then causes our kidneys to start failing, right? In our blood vessels, again, it damages the lining, the endothelial lining, and the endothelium is the inner layer of the blood vessel. So it damages that endothelial lining, causing clots and scarring, right? And so if you damage the endothelial lining, right, with clots and scarring, guess what? You can have a heart attack, right? What if one of those clots was in your coronary arteries, right, and blocked your coronary arteries? That's why we're seeing such an increase in heart-related complications, right? We're seeing an increase in myocarditis. We're seeing an increase in heart attacks, right? because this inflammatory response, right, it causes clots. Okay. In our muscles, it can weaken our muscles, right? Again, muscles need oxygen too, right? So if we're not perfusing, right? If we're not getting oxygen to our muscles, how are they going to work, right? The muscle cells are going to start to die off, right? And the muscles are going to atrophy. Um, Pancreas, something we never think about, right? Our pancreas. With inflammation, it can damage our pancreas, and the islet cells, cells of Langerhans that are in our pancreas, right, that secrete insulin, those can die off due to severe inflammation. And so now we're actually seeing diabetes. People with type 1 diabetes or secondary diabetes, right, because of this, the die-off of the islet cells. Liver, cholangiocyte damage, right? Clotting in the liver, right? Clotting damage to the liver. We're seeing much more liver failure. All of those odd cases of pediatric, right, liver failure, likely most of those study participants, or most of the kids in the study, they did have COVID, as far as I know, as far as I've read. And then, the lungs. COVID can cause permanent damage to the lungs. Microthrombi, you can develop a pulmonary embolus or a clot in the pulmonary artery, which then, if you have a clot in the pulmonary artery, I don't know if you've ever watched coroner shows, but if you have a clot in the pulmonary artery, you can die, right? You can die in your sleep. It's not a good thing to have pulmonary emboli, right? It can, even if you don't die, it can permanently damage your lungs. On the thread, I was reading a lot about people who had lost 50, 60% of their lung capacity. So because, again, this is the inflammatory process. Inflammation causes scarring and clotting, and just damage to the tissues of our organs. So because of this damage, and remember, this doesn't just last a few days, like it doesn't just last as long as you see the symptoms. This is an ongoing damaging effect. So one of the complications is that loss of lung capacity, a very common complication. And then we get to the brain, right? Degeneration of neurons, demyelination of neurons, which means the neurons they're cells in our brain, right, that carry impulses. They have a coating, right? So they usually have a coating called the myelin sheath. So this is a neuron. This is the myelin sheath. And so this coating covers this area, the axon, right? And so what it does is it carries the signal to our muscle cell. So here's our muscle cell. And this is what causes us to have all of our, neuromuscular activities, right? Like movement, right? So what happens is the virus, because it causes the bradykinin to get past, bradykinin kind of breaks up that blood-brain barrier. And so inflammation can proceed into the brain. And so what ends up happening is, this axon, which communicates to our muscle cells, is destroyed, right? And that's why we see things like movement issues and, jerky movements. And that's why we see brain fog. Lately, there have been articles now that have proven that people actually have dementia-like symptoms, right? Because of all of the damage that's happened within the brain. There was just an article where scientists developed these tiny brains, and they exposed these brains to COVID viruses, and basically they saw that a lot of the neuronal cells died because they were exposed to the virus. And it does lead to those brain symptoms that people are having, like the brain fog, the confusion, the dementia-like symptoms. So hopefully this wasn't too unclear, but basically it leads to multi-organ failure. COVID-19 is an inflammatory disease, a systemic inflammatory disease that leads to multi-organ failure. So just some questions to think about. Acute respiratory distress syndrome, that's what we heard about a lot, right? That's why we started thinking COVID was a lung disease. Acute respiratory distress syndrome, right? That's when we get fluid, right, in both lungs. That's not the only cause of death, right? People have died of kidney failure, of heart attacks, of stroke, right? All of that has happened, right? It could be for any number of reasons. And I think that's why the rate of COVID deaths is probably not completely accurate, because even if you're having some other outcome like myocardial infarction, like a stroke, something like that, even if you're having that, the cause initially may have been COVID-19. Something else to think about is who is most susceptible. We can't forget populations that are marginalized, populations that may not have access to care. There have been a lot of studies done and a lot of articles about this, and unfortunately it is, our Black populations, our Latinx populations that have suffered the most, our socioeconomically challenged populations that have suffered the most, right? And part of this is socioeconomics. When I say Black and Latinx, I don't mean because of race, because race is not biology. What I do mean is that there's a mistrust of the healthcare system, which may preclude them from getting treatment. So that's who's the most susceptible, and that's where the highest death rates are. We have developed vaccines, Pfizer, Moderna, the mRNA vaccines, Johnson & Johnson, which now, we are not giving, AstraZeneca, which was widely given around the world. We did not use it here in the US. But there's a lot of vaccine inequity. You never hear about vaccines in Africa or vaccines in South America. What's happening there? Are they getting the vaccines? And the answer, unfortunately, is maybe not. Are they getting the testing? I mean, testing is pretty non-existent here now. I mean, we do have home tests, right? PCRs, but that's kind of, it's not as easy for us to get testing as it was before. But there's a lot of vaccine and testing inequity across the world. So we really need to look at it in a global way. Boosters. A lot of people got the initial vaccines, but kind of the boosters, things kind of waned off, right? Novavax is being talked about now on Twitter as being very effective. It is not available in the US. I don't think it's FDA approved yet. And I don't know the politics behind that, but that's, people are saying that's why likely it's not been approved. And now there's the bivalent vaccine, right? It's supposed to be more effective with the newer strains, right? The BA.5 strain. It wasn't tested on humans, right? Extensively on humans, but many of us have gotten it, although, not that many. There's a really vaccine hesitancy now, especially since it's not been tested. I personally have gotten the bivalent vaccine, but it remains to be seen how many people will get that. There's, with all of this misinformation and mistrust, I think there's a fear now of getting this bivalent vaccine. Variants, again, Omicron, right? BA.5 is the most, people, it's the most numerous, right? It's the most of the vaccine, sorry, most of the virus is BA.5, but it is switching into BQ 1.1 and BQ1. And the problem with that is those viruses have mutated. And so our treatments, while they are still effective, they're not quite as effective. And things like monoclonal antibodies will likely not work on BQ 1.1 and BQ1 because they've just mutated too far. And that's the problem here. The you do you philosophy has led to huge levels of virus variants, right? Because the viruses just keep mutating, and the more you let them go, the more they're going to mutate. So the variants, right, are getting further and further away from the parent variants, right? So Omicron, right? We started with Omicron, but now, the genetics of the viruses are so far away from, well, not so far away, but far enough away that we are going to have some difficulty treating people with BQ 1.1 and BQ1. Again, our treatments still do work, but they are losing effectiveness. The opening of schools, I know, was a heated topic. Carriers, right? It was thought for a long time that kids couldn't be carriers. Kids didn't get COVID and kids couldn't be carriers. And, good science, I'm not sure why that was. I'm not sure why people thought that, because you can carry the COVID virus and not have symptoms. You can be completely asymptomatic. And so that's what happened. When schools opened, it became a free-for-all. Kids carried the virus back home and infected other people. And I am not here to be political or to say, schools should open or should not open. I am here to say, however, if schools are open, proper precautions need to be taken. Transmission needs to be limited. Why aren't we masking? Why aren't we distancing? Why aren't we encouraging vaccines, right? So now what's happened is now children with the variants, children are coming down with severe COVID and dying from severe COVID. Initially, we saw this multi-system inflammatory syndrome, and we know now, that's COVID, right? Multi-system inflammatory disorder, that's all about COVID. So now children are getting COVID and dying from COVID. And coupled with that, they're dying and they're coming down with RSV and influenza. And RSV and influenza, it's not more prevalent, like there aren't more cases of it necessarily, but the virus itself is doing more damage. It's more severe. The illness is much more severe. So kids are now dying from influenza and RSV, and adults never got RSV. And RSV is respiratory syncytial virus, and it causes inflammation in kids' respiratory tracts and like mucus and fluid buildup, right? So kids can't breathe. But now this is happening to adults. And adults are coming down with serious cases of RSV. Usually adults don't have any symptoms when they have RSV, or they have very mild cold symptoms. So this new influx of RSV into adults, right, or this more severe presentation of RSV is really different, right? One thing I want to point out too, severe disease, severe COVID, you don't just clear the virus. It can take months and months and months to clear the virus. So that virus is hanging around and mutating as as this person has this severe illness. It's chronic. And honestly, that's what the virus is doing with all of us who have contracted COVID. I've gotten it once, right? The damage that this virus does, it's not, we're not able to necessarily see it, right? It's a chronic asymptomatic thing that can cause symptoms somewhere way down the line, months later. So we have to be, I mean, the best treatment is prevention. If you've gotten COVID, please don't get it again. Please wear a mask. Please get vaccinated, right? It's the best, it's the only advice that I could give to my students. And unless, you know, you all have something else that you've read or have heard of, I think that's the only advice right now that we can give. So now we get to long COVID, right? And with long COVID, as you see, it affects every body system. Neurologic, right? Ischemic attack, which is stroke, right? Loss of the sense of smell, loss of taste. I lost my sense of smell and taste, even though I tested negative. Every time I took the test, I tested negative. But even so, I lost my sense of smell and taste for 6 months. Sleep issues, memory issues, right? Headache, weakness, nerve pain, all of those things can happen with COVID because COVID also damages nerves. It damages your immune system, right? A lot of literature has been coming out, and thank you for those of you who have pointed that out. A lot of literature has come out about COVID damaging the immune system, right? It's dysregulating your B cells and your T cells. And so with that immune system dysfunction, we are going to see more severe disease. And I'm not sure why we're talking about immunity debt when it really is about our immune system and what COVID has done to it. We've talked about the cardiovascular effects. Months out, we will probably see heart attacks, pericarditis, which is an inflammation of the sac around the heart, right? Hematologic issues. We'll see clots, right? Pulmonary emboli, arterial clots, right? A lot of blockage of vessels. We can see, bowel ischemia, which is where, a clot gets in the vessels of your small and large bowel, right? Your small and large intestines. And that can kill off, your gut. That can kill off your intestines, can cause a massive infection. Renal, chronic kidney disease, damage. There is long-lasting damage to the kidneys causing chronic renal disease. Endocrine, we talked about diabetes. If, you're causing clots and damage in the pancreas, right? You are going to kill off your islet cells, right? You're going to kill off, other cells in the pancreas. You secrete pancreatic enzymes to digest. So there are pancreatic complications, right? Along with, there are pancreatic complications like diabetes mellitus. Thyroid gland, right? Your thyroid hormones. There have been reports of thyroid damage, which then causes your thyroid gland not to be able to secrete thyroid hormone, causing hypothyroidism, right? Mast cell activation. Some of you have talked about mast cell activation because in an inflammatory response, your mast cells are secreting histamine and other chemical mediators, causing this inflammation, right, to go on and on and on, right? So these are just some of the effects, right, of long COVID. So right now, as I said before, BQ 1.1 and BQ1 are rising. It's able to get past our immune defenses. People, even vaccinated people, we have to get away from the myth that it's just the unvaccinated, right? Pandemic of the unvaccinated is not true. People who are vaccinated are getting it not just once, but multiple times, right? And the more you get COVID, the higher risk you're at for all of those COVID complications and long COVID. Okay. And the new variants, 1.1 and 1, they're more transmissible. We don't know yet about severe disease and hospitalizations. It looks like they're causing more severe disease, but I don't know yet whether it does or not. I don't think that there's been a final judgment on that. And the more we let variants kind of run amok, our current treatments, they're not going to be as effective. And it's just going to get worse and worse until they stop working at all. So we really need to prevent this. We really need to mask up. We really, vaccines don't cure it. Vaccines don't stop transmission. They do help us not die. They do help us. They do help us from getting severe illness, but we're still transmitting COVID, even vaccinated. So this thinking that, if you're vaccinated, don't worry, it's not true. You still need to mask, right? You still need to distance and not go into, crowded venues and not go, or take precautions, at least when you're going into crowded venues. I don't know why that's so hard. So where are we now? All of these things, vaccines, boosters, bivalent vaccine, monoclonal antibodies, again, with the new variants, they likely won't work, right? Remdesivir, bebtelovimab, those are, two treatments that we are using for people who are hospitalized, IV treatments that we're using for people who are hospitalized for COVID, as well as steroids, high-dose steroids. Paxlovid, it is effective. The issue is there's up to 50% of people with rebound disease, rebound COVID. So maybe, the experts would know this more so than I would. Maybe the dosing needs to be extended. I'm not sure. But in the meantime, high quality masks, open a window, good ventilation, right? There's also a myth about long COVID not being real. Long COVID is real. Long COVID complications, they're real. And the Americans Disability Act, it does recognize long COVID as of July, I believe, July of this year, or maybe it was last year. It did recognize long COVID as being a cause of disability. So it is real. It's not, I think there's a lot of misinformation on, on media, but it is real. Here are just a few resources. I cobbled resources together to teach my students. It was tough, back in 2020 when I started talking about this, but now there's actually a lot of resources out there. Hopefully this has been helpful. If not, at least you listened. Please, please, please try and educate people about what COVID is. It is not a respiratory disease. It is not over. It is a severe inflammatory disease, and it is chronic. We will show effects of this far out into the future. So I don't know why there's a lot of misinformation out there. I don't know why people don't know the basics of this. But what I do know is that there are a lot of people who haven't been educated about this. I feel like, and I feel this myself, that we want to give up because people aren't listening. But there are just some people who don't know. There are young people who want to know, right? Our medical students, our nursing students, our healthcare students in general, OT, PT, speech therapy, all of those students want to know, right? So we need to educate. We need to spread the word, because No one's going to do this for us. So I really hope that you take this message and you're able to spread it to a few people, because talking about this is really the best way to control this virus and to get control and to stop the deaths. Thank you for listening.